Hey everyone, it's a dose of Dr. Drew.
It is indeed. I want to thank our friends at Hydrolite, although we got frozen trying to give you guys the commercial.
Yeah,
This
let
is
me
their
let me
new.
put the banner up.
There, let's do that. Okay, you can find it at drdrew.com/hydrolite. Use the code drdrew25 at checkout for a special discount. And again, hydrating is key, whether it's in this heat or working out or because you've been ill. This product, the reason I wanted to invent it is just as good as IV therapies, which it seemed to me should have been something we could invent, and lo and behold, these guys did it, and now I'm angry. I wish they hadn't done such a good job, but I'll happily stand behind them. In the window next to me is the great Gary Donovitz. You've seen him on our streams before.
This life you live.
On This Life You Live, he's a gynecologist. He is what is your official title at BioTE? CEO?
No, I'm the founder and chairman.
Founder and chairman of BioTE. That's BioTE Medical LLC. This is changing healthcare through bioidentical hormone therapy. He's a champion of changing healthcare through individualized comprehensive treatment, hormone optimization. His previous book, Susan, do you have the previous book there, which is about where we went wrong on hormone therapy? The new book is this one that I wrote the foreword for. And it's something you've heard Susan and I championing for quite some time, which is the importance of testosterone therapy. Oh, it looks like we're frozen here also on the stream, by the way. But anyway, importance of testosterone therapy, not just for men, but for women as well. Dr. Donovitz, welcome to the program.
Thanks. Glad to be here. Good to see you again.
You as well. Also, I want to just quickly shout out our friends at Red Hawk, the UVC devices that help sterilize surfaces in like 20 seconds. I'm a big proponent of the UVC. The Red Hawk website, Susan, you can get that for me, and I will push that out in a minute. So, Gary, what is going on these days in bioidenticals and hormone therapy? Is it catching on more, or are people understanding the importance of all this?
Well, I think the patients are understanding the importance and the doctors are understanding the importance. There's a lot going on, maybe at the government level, that is saying, hey, what's happened to all the money the big pharma was getting on its hormones? It seems to be going down, and it's going down because the bioidentical hormones have actually taken off. They've taken off so much that over 500,000 people are now enjoying our therapy, and that's great because they're doing so well and feeling really good. So that's great. And by the way, I got my new book just released, Testosterone Matters More. And it's really timely right now with both COVID and with everything going on out there. So how do people feel their best no matter what their age?
So here's a great question straight off the top. I'm going to sort of toss them out to you as they come along here. Can we differentiate between need for hormone replacement therapy and psychotropic? Which is, maybe we should look at case A on this, Miss Susan Pinsky. Susan, do you want to tell your story quickly about what they were treating you with and then when you found bioidenticals?
Well, I started menopause in my 40s, early 40s, 42, 43. And by the time I was 45, I was having anxiety disorders. So they gave me therapy and antidepressants because I had triplets, and they figured I was just losing my mind.
Which
and
we were.
At some point, I ended up, my period stopped and around 45, and I felt terrible. People would look at me and go, what is wrong with you? I'm like, I've been sweating all night. I feel terrible. I went to my doctors. They gave me a handful of cocktail of drugs to take. One told me I needed to just get Drew a mistress and
let it be.
Basically go get therapy. He said I was crazy and maybe I should just let my husband have sex with somebody else. So I got rid of that doctor, and I was going in and out of doctors' offices, and then finally one day my girlfriend had a hysterectomy, and she was pretty young. She was in her 40s, and she went to this doctor because she didn't have any ovaries or uterus, and she said, I'm on these bioidenticals and I want to have sex with my husband every day. And she was the last person you'd ever hear that from. And I was like, well, sign me up. So I went in, and I swear a week later I was so angry that I suffered for so long. I was 50 then at that point, and I was so happy to be back and not crazy, didn't need medication.
She'd been on psychotropics, inappropriately diagnosed. Again,
but I was young,
If you miss the real diagnosis, it can look like depression, right?
Oh, absolutely. And that's the problem. So many people, in fact, when you look at people in the prime of their life, 25% of women are on antidepressants, and they're really not antidepressant deficient. So we weren't deficient in antidepressants. No one thought, well, what could be the root cause? And the root cause really is that their hormones were not optimal, but did they even look at the right hormones? So if you look at the wrong hormones, you get the wrong answer. And you know how that is. And with Susan, just like everybody else, they want to medicate them, but actually the medications could make them feel worse.
Yeah, and then I've got a few questions online here. Is it dangerous to go against nature? Dave, we are going against nature for roughly 40 years towards the end of our life. And living after the age of 60 is not going with nature. Nature did not intend us to live this long. It's because we understand biochemistry and physiology that we can adjust things and extend life expectancy. My favorite scene from, do you ever watch The Nick, Gary, when you were, the TV show The Nick?
Yes.
The first episode, my favorite scene there, he's eulogizing his peer at a funeral, and he says, it's 1900 now, and because of the incredible technological advances at our hospital, the average American born today can expect to live well into his 40s. And that was 1900.
Well, that's exactly right. You know, if you go to like the Tower of London and you see all the old queens, it's like this one died young, this one died young, the king died young. People didn't live long enough to actually make it to menopause and andropause. So really, there's no reason to talk about hormones back that early. It wasn't until later when we got a handle on infectious disease that people started living longer. The problem is we made people live longer, but we didn't consider the ramifications, like what about their brain and their heart, their bones. And because of that, you're seeing people that are demented with hip fractures and heart attacks and strokes and Alzheimer's that are living longer, but do you really want to live longer unless you can feel better? But to your point, I mean, people died so early on. We're not going against nature. We've actually said, okay, you want to live longer, we'll make you live longer. But in order to do that, we need to restore the hormones that you had, not with synthetic hormones. It's very interesting that people take medications, and for that matter, hormones, that they never made in their whole life. They never made horse estrogen. They never made these synthetic hormones. And they never thought about why would they not work or why would they have more side effects? That's what we address every day. What if we just replaced your hormones with the hormones that Susan made all of her life? Would she feel better? And indeed, that's the truth.
Somebody's asking, I've been told because of blood clotting issues, I can't be on hormone therapy. She wants more information.
Right. So what we do with pellet therapy primarily, and sometimes creams, but with pellet therapy and even creams for that matter, we don't have any increase in hypercoagulability. So that means there's no increase in blood clotting. So people who have had blood clot or DVTs now can actually have hormones. So you don't have to be miserable the rest of your life. There's actually no increase in clotting with the therapy that we give, and not one study in the last 80 years has ever shown an increase. So we feel relatively good about that, and the safety factor is there for you.
Interesting. And let me see if there's other questions for you straight off the top here. So what about testosterone? Why does testosterone matter? Oh, well, I know what I want to say before we go into that. So Susan recently got some pellets in, and they inadvertently put in less than they usually do. And what happened, Susan?
Or one of them seeped out because I took the little strip off too soon. I haven't felt myself. I'm having an anxiety disorder every day, just like I did when I was 45, and they sent me to therapy. Usually I have like hot flashes, but I think I have like a little less than usual. I feel okay. I sleep well, but I feel like I want to punch somebody in the face. My estrogen is just through the roof right now. I don't know what it is.
Try not to do that. So here's the thing. Here's the thing. There's a big difference between hormone replacement and hormone optimization. So obviously, Susan felt good when her hormones were right, and now they've given her some hormones, but not enough, and that's not going to work as well. Now, why does testosterone matter in the new book more? That actually came off of a book that another doctor wrote called Estrogen Matters. And estrogen does matter for women. I'm not discounting that. The fact of the matter is, though, that women make 4 times more testosterone than they ever did estrogen every day when they were feeling good. but they don't know that. So they don't consider testosterone a female hormone. They consider it a male hormone. The problem is testosterone gets more of those symptoms, like Susan's talked about, and other people will probably call in and talk about, than does estrogen. It gets more of the fatigue, more of the sleep problems, more of the mood problems, more of the depression problems, more of that brain fog. All of that is testosterone. So considering the fact that more women have those symptoms than hot flashes and vaginal dryness, it makes more sense to use the hormone that makes them feel better and the hormone that's more important no matter what decade of life. There was a consensus report that came out last year, Dr. Drew, and what it said was, and this was 12 people internationally that got together, they said testosterone was the most important hormone for women no matter what decade of life. We've got to focus on that.
People are asking, can it be used in polycystic ovarian disease?
Absolutely. So the problem in polycystic ovarian disease is because you're insulin resistant, your sex hormone binding globulin, this protein in your bloodstream that binds up testosterone, you don't have as much as other people. So we have to dose it lower. But by dosing it lower, you still get the benefits because the free testosterone is exactly where we want it, and we can do it safely and without a great deal of side effects. And that's really nice for those people with PCOS.
And then people are asking, how do I find a doctor to help me with this?
So what I would do is just go to biotmedical.com. We have a find a provider across the nation. We have providers in 50 states. There's 5,000 providers out there. So you can find somebody that's been certified, somebody that we've trained, mostly that I've trained too, and that these people are certified both in the therapy and the insertion and how to optimize your hormones.
All right, let's try phone calls and see what we get here.
There are none.
There's one. Hi, you're on the air. Or is that my screen?
That's Lindsay.
Oh,
Nobody's calling.
Yeah,
what is George's girlfriend's name again?
Wanda.
Okay.
I didn't know that Lindsay was screening for us.
Yeah, she's screening because you said you only wanted calls, but nobody's calling. Everybody call in and talk to Dr. Gary because he's here. You've been asking. Okay, I'm going to put your... So, okay, I can't make people call.
You mentioned, Gary, that it's important in the time of COVID. Why?
Well, for one thing, optimizing your hormones boosts your immune system. That's one thing. The other thing that we do at BioTE is we put people on other things like thyroid and nutraceuticals. One of those nutraceuticals is a product that has vitamin A, D, and K2 in it. Vitamin D is very important in boosting your immune system. So we can actually, by optimizing your hormones, being on the right vitamins and minerals, we can actually reduce the severity and your chances of getting COVID. And we've seen that now with our practitioners. They're seeing less patients with COVID, and the ones that are getting COVID-19 are much less severe cases. So we think we're on the right track by keeping your immune system heightened. And keep in mind, women, of course, have less COVID than men, and it's because they have great immune systems. So both men and women would benefit by having their immune systems boosted, especially with men getting more COVID. Keep in mind, we've talked about women tonight, but testosterone matters more for men too, and they should consider getting their hormones optimized in order to keep up, number one, with their wives who are getting testosterone, but moreover, so that they feel their best no matter what their age.
You know, there's what, Susan?
I was going to say, he was talking about women's hormones. I went to to get my pellets, and my obstetrician said that a lot of the pregnant women weren't getting COVID. They had better immune system because of the hormones. And I said, "Oh, is it testosterone?" And she said, "Oh no, it might be the estrogen."
It also might be the way
or the progesterone.
You know,
I can't remember.
Local immune system is suppressed because you have a foreign body growing in you, and so there might be something.
You're already
to that.
fighting against that, right?
Yeah, so it's complicated, but I was thinking,
what does Dr. Gary think, though?
Well, I'll ask him, but I also was going to say that for COVID to enter the body, it binds the ACE2 receptor site in our respiratory tract. There's a cofactor protein that is androgen receptor dependent. It's an androgen receptor of sorts to get the COVID in. I'm wondering if the testosterone replacement downregulates that or something.
Yes, I think that it does. And what we also see is there's decreased binding on high-dose vitamin D. So you have the downregulation of the receptor, decreased binding of the virus to that ACE receptor, and the combination of those two. I think that's why we're seeing less. In terms of pregnancy, it's interesting because in California, they're actually using progesterone because it is an immune booster in men, as well as estrogen. Now, we don't actually recommend estrogen and progesterone in male patients, but we are seeing it in California for its immune boosting capability. So I think Susan's probably right.
Maybe
Even
progesterone.
though, yeah, progesterone actually in males, we don't
I take that
do
every
that.
day too. So
Good.
Monica's asking, I strength train daily. Can my muscle mass exacerbate menopausal symptoms?
So if you're strength training, what happens is you actually metabolize your testosterone faster. So what we always say is we'll set the dose of testosterone for you, but then you set the frequency. In people who work out a lot, marathon runners, CrossFitters, those people, they actually will metabolize their testosterone faster, even their own endogenous testosterone. So you would need either more frequent or higher dose, but that's not a competition. So yes, you would do better getting your hormones optimized and then increasing the frequency based on your workouts.
So I mentioned the ACE2 receptor, and Daryl's asking, does an ACE inhibitor affect the ACE2 receptor? Now, it turns out both ARBs and ACE inhibitors do not affect the binding or the ability of COVID to get in your body. So continue your antihypertensive medication.
Yes, absolutely.
we have a couple of calls.
Let's talk about breast cancer myths. What's going on that way?
Yeah, it's not a myth, and it's actually, I haven't got to even talk to you about it, Drew, but the cool thing is we just finished our study, which was a 10-year prospective study. It's the largest study ever done, 3,000 women, 10 years, prospectively, either getting testosterone or testosterone and estradiol in pellet form. It looks like there's a 70% reduction. We had 12 breast cancers in 3,000 women, 70% reduction over the 10 years. So I said, how do I actually put that all together? So I went back to the Women's Health Initiative and I looked at the placebo group. There was 10,000 women, so about 3 times as many people in the placebo group, but they had 30 breast cancers per year. We had 12 breast cancers in 10 years. Becky Glazer just published her 10-year data a couple of months ago, actually about 4 months ago now, and she had nearly a 60% reduction in breast cancer doing nearly the same thing. The reason is testosterone actually downregulates that receptor in the breast that causes proliferation of breast tumors. And so because of that, we're able to reduce breast cancer. The other thing we're able to do is in breast cancer survivors, actually treat people with hormones so that breast cancer survivors have a great life also. And people to this point haven't been able to do that.
So I want to make sure I frame what you said. So it is that the testosterone is the key in decreasing any potential risk that might be incurred by estrogen replacement.
Exactly. So whether it was with testosterone or with testosterone with estradiol or estrogen, it actually didn't matter. There was still a reduction. So it looks like testosterone is actually protective to the breast, and it's really good because now people can actually take hormones that had a family history, because so many people come into the doctor with symptoms that Susan talked about earlier, and they're like, ooh, I really would like to get my hormones optimized, but my fear is I'm going to get breast cancer if you optimize my hormones. Right. And now I know after 10 years prospective data, and I wanted to do it for the longest time possible, that we could reduce your risk of breast cancer so you can actually get hormones, whereas it was your biggest fear.
Interesting. All right, now, Jessica, you're on with Dr. Donovitz.
Hi, guys. Thanks for taking my call.
You bet.
I recently had a hysterectomy due to pretty severe endometriosis, and I'm only 40 years old. They did leave my ovaries, however, but I do feel like it kicked me into menopause, even though they left the ovaries. I'm having very dry, itchy skin, lots of headaches, pretty extreme brain fog, and then oddly it seems like I have food allergies all of a sudden, and I had the hysterectomy in November last year. So any thoughts about the allergies or anything to do with maybe some of these other symptoms like the fatigue and allergies?
Yeah.
Yes. So what happens is, number one, women start losing testosterone in their mid-20s. By the time you're 40, you're actually 50% depleted in your testosterone. When you have a hysterectomy, even though they leave your ovaries, we're seeing an accelerated deterioration of your hormones. So everything you said is actually not rare. I've seen it. I've been doing this for 35 years, so I've seen it all the time. And what happens is people. Well, I think it's because we've interrupted the blood flow. Even though you have the ovarian blood flow, when you interrupt the blood flow between the uterus, so now we have different blood flow, we're seeing an accelerated deterioration of ovarian hormone production, exactly what you've talked about. And people say, well, you still have your ovaries, so you're not in menopause. Well, that may be true in the purest sense by lab work, but again, testosterone deficiency is a clinical syndrome. Dr. Drew and I talked about this a couple of years ago, and it is a clinical syndrome. It's not just founded with what's your blood test. It's really how do you feel? Right. And you've just told me how you feel, and all of those symptoms relate to not being optimal in your hormones. So a hormone blood test would tell us where you're at. And a hormone blood test will tell us how to optimize your hormones, whether it's thyroid, whether it's testosterone or estrogen. And you may not need estrogen yet, but certainly your testosterone won't be optimal. Your thyroid may not be optimal, and we can optimize those in advance of you going into menopause.
Got it. Jessica?
Got it.
All
Thank
right.
you.
Thank you for your call.
Thanks, Jessica.
Now is Emily. Let's get Emily. Go ahead, Emily.
Hi.
Hey there.
Hi, Dr. Drew. This is Emily.
Yes.
So I'm 57 and I'm a really healthy person. And when I stopped my period stopped a couple.
Emily, we lost you. Hold on 1 second. Emily, start again. You lost your period when? Oh, Susan's screwing this up. Well, hold on a second. These are interesting calls. There, hang on, Emily. Wait a second. Susan's messing with the phone system. Are we good?
All right.
All right. You lost. You.
I'm here.
Stopped having your period when?
Okay, so I stopped having my period about 2 years ago, and once I did, my sexual drive became non-existent, and when I do have sex, it really hurts. And secondly, I have hair loss. And so you normally have a big head of hair, but it's, I'm losing it quicker than I want. And even in my pubic areas, there's no hair and my eyebrows are thinning. So I just want to know if you have any advice.
I do. First of all, the most common cause for hair loss is thyroid. Everybody thinks it's too much testosterone. It's not true. Much more hair loss occurs because of thyroid. 40 to 50 million Americans are hypothyroid, at least clinically, which you are. And so that's where I would start. Second of all, you haven't had a period in a couple of years, so your hormones are not going to be obviously optimal. I would probably think your testosterone is low as well as your estrogen level. By looking at all those hormones, we can actually optimize all of them. You would feel completely different once your hormones were optimized. And again, it's not just testosterone, although testosterone matters more, but thyroid is very important. And with hair loss, most women lose the hair on the lateral 1/3. That's the outside 1/3 of their eyebrows. And so I'm betting that's where yours is. The loss of the pubic hair and other hair generally in your head also is consistent with that. So I would consider getting my blood tested and then optimizing all of those hormones.
Now, in terms of blood tests for thyroid, you're going to have to get free versus bound, right? You have to really dial it in a bit.
I can't hear you.
Uh-oh, he's lost me. You hear me?
Ooh.
I can hear you.
Okay.
Nope.
I can hear you.
Okay. Well, let me just say that there are a couple things. The estrogen will take care of the vaginal dryness. The estrogen will improve the hair. The testosterone will bring the sex drive back. The thyroid will bring the hair back. But that thyroid has to be dialed in by somebody who really knows what they're doing with that. And it makes me also wonder about adrenal gland too, because that hair issue, sometimes adrenal insufficiency could be associated with that. Donovitz, you hear me yet?
Yeah,
I can hear you, but I don't think people at the, we are in a cytokine storm.
Yeah, Susan, I can't hear y'all at all.
The chat stream, you can see me though, right?
Well, now I hear you.
Okay, hold on. Everybody hold on.
Nope, I don't hear you. Something changed. Actually, your screen's all frozen.